Hi again, welcome back to Karlee's farm. I'm just going to take a few minutes really quickly here to talk about some medicines that moderate how much hydrogen or acid is produced in the stomach. So I'm just going to stop and draw us a parietal cell, the main proton producing cell of the stomach. Okay, so here we have the parietal cell, the main cell in the stomach that produces acid. And on the parietal cell there are multiple different receptors, meaning that that particular cell is under the influence of various different chemicals. So the main one that we really kind of target, I guess, from a therapeutic perspective is the histamine receptor, so the H2 receptor. So remember, there are these ECL cells that produce histamine. Histamine binds to the histamine 2 receptor cell, which tells the parietal cell to make more acid, and more acid is produced. There are a couple of other receptors that also tell the parietal cell to make acid, and that is the CCKB receptor, which is responsive to gastrin, and the muscarinic 3, or the M3 receptor, which is responsive to acetylcholine. Now, interestingly, both gastrin and acetylcholine also positively influence the ECL cell. So not only do they themselves tell the parietal cell to make more acid, but they also come to the ECL cell and say, can you please make more histamine? More histamine tells the parietal cell, make more acid. So from a pharmaceutical target perspective, the one that we see that we target primarily is to block this H2 receptor. So that particular block by the H2 receptor blockers is competitive. Okay, so with enough histamine around, that block can be compromised, but we have the option to block the H2 receptor. And these H2 receptor blockers are specific to H2, because remember, there are other histamine receptors floating around the body, but these are targeted to the H2 as much as they possibly can be. The other therapeutic target that is used really commonly now is to block the hydrogen potassium ATPase pump. This is blocked by a group of drugs called the PPIs, or the proton pump inhibitors. Now, obviously, the PPIs are a more effective therapeutic option, and that is because they block the hydrogen release at the terminal phase. So they block this pump from releasing hydrogen, which means that no matter what is happening in terms of stimulation to release hydrogen, that pump blocks it. So it doesn't matter if you're getting a lot of stimulation from down here, it can't get out. What that means is that the PPIs, they block both basal and stimulated acid release. Okay, so they just block the parietal cell from being able to get any of that hydrogen out. Now, in terms of, I guess, the difference between these two drug classes in terms of where they're used in practice and their side effects, the PPIs are much more common, as I said before, used really commonly in practice. They cost the Australian Pharmaceutical Benefits Scheme a lot of money every year, and that is because they are generally well tolerated. Okay, so people can take them and have little to no side effects. In fact, very commonly no side effects. These are drugs such as omeprazole, pantoprazole, so the razoles. What they can do is you can get a malabsorption syndrome from them, particularly for some things like magnesium and calcium that need acid to be absorbed, which can then lead to bone fractures too if you have not enough of these floating around. They can cause an infectious diarrhea, so particularly with things like C. difficile. Basically, if you think about any condition where acid is required. So acid in the stomach is usually protective, and so what we're doing is taking some of that protection away. So protection from organisms, for example, and a lot of the things that we eat and nutrients that we take need an acidic environment to be absorbed. So we have to think about malabsorption in the context of having reduced acid in our stomachs. Now the H2 blockers, the histamine 2 receptor blockers, similarly also really well tolerated. These are usually associated, these are things like ranitidine, famotidine. You can get these, both of these classes now you can get over the counter, you don't need a prescription for them. So these are the tadines. They're well tolerated, they can cause a diarrhea as well. They can cause some neuro side effects, so things like dizziness. Also for elderly people, confusion. And that's possibly due to some histamine 1 activity. So sort of being antihistamine, causing a bit of dizziness, drowsiness, etc. So they're the two main classes that we use to reduce the amount of acid floating around in our tummies. The other class, which I guess I'll just sort of bring to your attention, is the prostaglandin analogues. Now, the you might notice here that prostaglandin receptor is actually negative receptor. So this equals a reduction in hydrogen release. So what we want to do here is increase activity at the prostaglandin receptor. So we do this using prostaglandin analogues. And that is, there's one that we use in practice, it's very rare, and it's called misoprostol. Now the last group that I'm not going to draw on the board are a group of medicines that are really just used to neutralize the acid that's sitting in the stomach, and that is the antacids. So these are mostly used for symptom management. And some people who don't sort of chronically get a lot of symptoms can use an antacid just as required to reduce the symptoms of acid in the tummy. Now I've got some here to show you. This has come from some antacid that I have here. I wanted to just show you, because basically what it is it's putting base ions, so usually bicarbonate ions, to neutralize the hydrogen ions, and it comes out as a gloopy, thick suspension. So it's not very palatable. They've made it mint, just I guess just to confuse you so you don't think you're drinking chalk, but it's a chalky sort of texture. But a lot of people can get away with just taking those, and you know, we tell people as little tricks to keep it in the fridge, because when you're getting a lot of heartburn, pain, having a cold thing, and it sort of coats down the esophagus and into the top of the tummy. So hopefully that was okay. It's a pretty quick little rundown, but there's only two kind of primary classes that we currently use to treat too much acid in the stomach. I will just quickly mention, although we don't use them very much in Australia and they're not on the PBS yet, but there is sort of coming, there is a competitive antagonist here that will work really similar to the PPIs. So their place in practice is sort of yet to be established, but keep your eye open for those. Thanks for joining me. See you next time.